All right, with no further ado, I'd like to introduce our guest speaker, who is Melissa from Extension, and I'm going to have her welcome herself and share a little bit about who she is and how she got to where she is today.
Well, my name is Melissa Prupson. I am a medical laboratory scientist. I work at Ascension Calumet Hospital in Chilton. I've been at my position now for 18 years. I am currently the manager of laboratory and imaging, and I also oversee our family practice operations, so all of our providers that are on site at the hospital. I went to college at Stevens Point, UW Stevens Point. I majored in medical technology, but now it's called medical laboratory science. So it had a little bit of name change. And also at some of the universities, it's also called clinical laboratory science, but it's all the same career. So I majored in that. And then I also have a minor in chemistry and biology. It took me about 5 years to complete that degree because I did take some extra biology and chemistry classes. And I also did an internship at St. Vincent's Hospital in Green Bay for 6 months before I was able to graduate. So I actually born and raised in the Chilton area. I went to Stockbridge High School with Dawn. So myself and Dawn have known each other for a very long time. And I currently live right in Chilton where I work. And that's about it.
Wonderful. So graduated from a small school, went to a 4-year college. Let's just start off with maybe some of the classes that you took in high school that you felt kind of helped navigate you to pursuing your degree at Stevens Point.
Okay. So in high school, a lot of math and science classes. I took biology, chemistry, and also physics. Those played a really big part in that. A lot of science classes.
Interesting you say physics, because I think many of us think of physics as an individual that's going into engineering, but
it is. But when I went to college, it was actually a requirement. It's not so much of a requirement now at all of the universities, but you do have to have some physics for this type of degree.
Wonderful. So when you first entered into your career, you graduated, you went into an intern. What did your internship look like?
Well, I was at St. Vincent's. Every day we worked in the laboratory from 6 a.m. until about 2 or 3 in the afternoon. We worked side by side with the laboratory techs on the bench. That's what we call is working on the bench. And we would draw patients' blood. We would run those lab tests with the lab techs. They would actually let us result those and give results to the providers. So it was working side by side with that tech, just as you would in the real world, and just learning. We would have time to study during that time. We would take tests also. They'd give us tests. We would have unknown samples to run. So it would be like previously run patients, and then they'd give us that patient to run to make sure that we got the same result that they did.
Got it. Wonderful. Well, I'd like to tap into more of really the day-to-day and what it is to work in your career path. Do you feel at this point it would be good to share your PowerPoint, or do you?
Oh, sure. Try to
share.
And
I know we have a question from a student is asking what a typical day looks like. So I'm going to maybe you're talking and you can incorporate that.
I can. So in my PowerPoint, besides clinical laboratory scientist or clinical laboratory technician, there's also different careers in the laboratory, such as a pathologist, phlebotomist, histotechnologist, and cytologist. So I also put that in here too, because those are also different options through like a laboratory science degree. So I also incorporated that in here. So with clinical laboratory science, we're the professionals that discover the absence or presence of disease. So we help that provider, that doctor, try to find out what's wrong with that patient that they're trying to treat. So we provide data to the physicians to determine the best treatment for the patient. We generate vitally important data for identifying and treating cancers, heart disease, diabetes, and many other health conditions. So the types of laboratory careers: pathologist, histologist, cytologist, clinical laboratory scientist, which is what I am, a clinical laboratory technician, so that would be like your associate's degree, and a phlebotomist, which is just like a certification degree from a tech school. The different areas of the laboratory, the first one would be phlebotomy. That's where you'd go to get your specimen collected. So it'd be like a blood sample, like urine sample, stool sample. Those are the people that would do like the throat swabs for your strep throat, things like that. So these are all
Excuse
just
me.
different types of examples of the types of collection tubes that they would use to draw blood. Then they also have all the swabs and things like that that they would collect samples from. Hematology, this is actually one of my favorite areas in the laboratory. So hematology is the study of the blood. So that's where we look at the actual cells in your blood to diagnose different anemias and cancers. So these cells right here, those are the cells that you would find in your blood if you would look underneath the microscope. This is what they kind of look like. So each one has their own function. For example, a monocyte and a neutrophil, if you have bacteria in your blood, you're going to find elevated levels of those. A lymphocyte would be elevated if you have a viral infection. Those are the different types of cells in the blood. This is what they actually look like underneath the microscope. So when the blood comes to the laboratory scientists will smear the blood onto a slide, they'll stain it and look at this underneath the microscope to look for any abnormalities. This is actually a picture of an abnormal slide. So this patient has a leukemia. So these are abnormal cells that are pushed out from the bone marrow into the peripheral blood. Another part of the laboratory is urinalysis. So it's study of the urine. We study the urine and we let the provider know of any abnormalities that may be caused, they have a urinary tract infection, bladder cancer, any type of kidney disease. So we'll look at like the glucose in the blood, if there's any white blood cells, red blood cells, things like that. This is what a urine looks like underneath the microscope. But when you're looking at it underneath the microscope, these little things are moving because these are white blood cells, these are red blood cells. You have some crystals in the blood that can develop if you have high levels of protein. So this is what the urine looks like. This is another picture of a urine. So this is a white blood cell. And then this is a red blood cell over here. So the laboratory tech would sit and look at these underneath the microscope and count these and let the provider know like how many they are and quantify those. Coagulation is the process by which the blood clots to form solid masses. So we test the patient's ability to clot to determine if they have a bleeding disorder. If you ever heard of hemophilia, so that's one bleeding disorder. Patients who have hemophilia, they lack one of the clotting factors that are in your blood. And we also test patients for if they're on blood thinners, like if your grandparents are on warfarin or Coumadin, those patients have to come in every so often to get that tested to make sure that their levels are at a normal state so their blood does not clot. And this is actually the Clotting Cascade. I had to memorize this when I was in college and I still kind of know it, I remember it. So if you're missing any one of these clotting factors, you would have a clotting disorder. So if you would get cut, you would start bleeding and you would not be able to stop bleeding. So, and they actually have these as medications to give to patients that are missing one of these clotting factors. Chemistry is another area of the laboratory. So this is the study of your bodily fluids, and we look at the serum, plasma, and whole blood, urine, and your joint fluids too. We can study all of the chemical tests in those different types of samples. So when you draw blood from a patient and you let that blood clot in one of those tubes that I showed you before, and we spin it down in a centrifuge, and it separates the cell part from the liquid part of the blood. So, and that's called your serum or your plasma. So we actually test that on our chemistry analyzers. And we'll look for things like sodium, glucose, potassium, calcium, your cardiac enzymes, liver enzymes, like your thyroid levels, things like that. Anemia disorders like B12, folate, things like that. Blood bank. Blood bank, this is the area of the laboratory that, actually scares me a little bit. This is not my favorite. Blood bank is where you determine what type of blood the patient has, and then you have to match it up with the donor patient. This is actually the part of the lab where you could actually hurt a patient if you do something wrong, if you give them the wrong blood type. I think this is why most laboratorians, this part of the lab kind of scares them a little bit, but it's good because then you pay really good attention when you're in this part of the laboratory. Because if you would give a patient the wrong type of blood, they could have a reaction and they could actually die from that reaction. So what we do is we take that patient's blood. We have a blood distributor called the Community Blood Center. They give us blood every week, and we will transfuse that blood to those patients that have low blood levels. Types of blood products, you have your red blood cells, your fresh frozen plasma, which is the liquid part of your blood, and your platelets. The platelets are the cell that helps you clot or helps you like heal. Microbiology, this is another favorite part of the laboratory for me, is the study of the microorganisms. The microorganisms are too small to see with the naked eye, and they're like your bacteria, fungi, and your viruses. And in microbiology, we study and we try to identify these microorganisms, and we try to find antibiotics to try to kill those infections. So in the microbiology department, we'll identify those bacteria, and we will test it against different antibiotics, and we'll tell the provider which antibiotics to use to help that patient get over that infection.
So Melissa, and you kind of talked about a number of different
Yep.
departments and areas. One of the questions that maybe before we get too far,
Okay.
Actually are kind of related. First one was to be a phlebotomist.
Phlebotomist. Yep.
Yes. So that, is, you said, was a tech program?
You can go to the tech school, and is actually it's a couple-month class.
Okay.
And all you need is a certificate. But most areas, most healthcare systems will take a person without a certificate. Like we'll train someone right off the street if they have a high school diploma.
Got it.
So
And
you don't really need that certificate.
Okay. And then if you wanted to go into more of the clinical lab scientist, do you have to, you had mentioned that you went to UW-Stevens Point. Do you need to go to med school?
No, you do not need to go to med school. No,
Okay.
it's just a clinical laboratory science degree. I know a lot of med school students, they will pick that field as their undergrad when they are at the university, because it prepares them pretty well for med school. A lot of the same classes that you would take for pre-med.
Got it.
So a lot of people do go that route. When I was in school, we had a lot of medical laboratory students that wanted to go to med school. So this is the route that they took, because you learn all these different aspects. You still have to take human physiology, biochemistry, things like that. So it's all the same types of classes, but then they learn more of the lab background too, which pre-med, you don't get a lot of that.
Got it. Perfect.
All right, so this is actually in the microbiology department. This is a blood agar plate, it's called. This is actually sheep's blood, this red, and this is bacteria that's growing on there. So in the microbiology lab, they would take one of these, it's called a colony, and they would put it into a big instrument to identify that organism. So then underneath the microscope, this is what it actually looks like. There's gram-positive bacteria, there's gram-negative bacteria. They come in all shapes. They kind of look differently, each different type of organism. And when you're in school, you have to learn those to be able to identify them underneath the microscope. So this is just two different types of examples. One other field of study in laboratory is pathology. So this, in pathology, this is the one that you would go to medical school. They are the doctor in the laboratory. So I actually report to a pathologist. He is my medical director. He signs off on everything in the laboratory, so he oversees all testing in the lab. And then plus he also does some laboratory testing work. They look at tissues and body fluids underneath the microscope for abnormalities. So this is something that they would look at underneath a microscope. So this is actually, I can't really see it very well because that thing is there. This is tissue. And then right here are some tumor cells. So they go to school to learn how to identify these things. So the pathologist, they will take samples from surgery, and then they will dissect those in the pathology lab to look at them underneath the microscope for abnormalities. So this is another one, necrotic tumor cells. You have your blood vessels over here and your squamous epithelium. Here's another one, another tumor cell. Another area of study is cytology. So that's a cytologist. For those individuals, they go to school to become a medical laboratory scientist, and then a cytologist that's 1 year after that. So they'd go another year in their specialized schools throughout the state. There's one at the State Lab of Hygiene, and there's one at Marshfield laboratories, where you can get your certification in cytology. So they will study the microscopic appearance of cells for abnormalities and malignancies. So that's all they do every day. They look underneath the microscope for abnormalities.
And typically these people realize that what pathway, or if they want to go into
Yep.
that further the certification once they're in schooling in their.
Yeah, they do. They do. So this is something that they would look at underneath the microscope. So this is actually a tumor cell. So education and salary for the different types of fields in the laboratory. You have your pathologist, that is a medical degree. So they would start out beginning at $300,000 a year once they graduate from med school and have their internship. Histologist, it is a bachelor's of science, and then 1 year after that, there's couple histology schools in the state, also at Marshfield, and there's another one too. So that's about $50,000 a year. Cytologist is a bachelor of science, then plus 1 year after that, about $60,000 per year. So the clinical laboratory scientists or the medical laboratory scientists, you would start at about $60,000 per year, and that's a bachelor of science. The clinical laboratory technician is an associate's degree, and that's about $40,000 per year. And the phlebotomist is like 1 to 2 semesters in a tech school, and it's about $30,000 starting. That's it.
Super. So a couple questions that students we have a number of them here.
Okay.
I'm going to go to, just as you finished up here, what is your favorite part of your job, and what is the hardest part of your job?
Well, when I was in the laboratory working, because right now I'm a manager, so I don't actually get out to do a lot of testing anymore. But when I was in the laboratory, I loved hematology. I love counting cells underneath the microscope and identifying those abnormal cells. That was probably the best part, was doing that. The most difficult part about being a laboratory scientist is getting pulled in so many directions. You have phones ringing, you have multiple tests coming in all the time, and trying to coordinate all of that. You really have to have good multitasking skills, and also troubleshooting, problem solving skills. You have to coordinate your day really well to get everything done in your shift.
Super. So what made you interested in having a career within clinical lab science? Like,
I've always liked science. I like to help people. So this was something that, I could do both. It's very hands-on. We don't get to be with the patients all the time, unless we're drawing blood, collecting samples. But I know behind the scenes that I am helping that provider care for that patient, because we're trying to solve, why is that patient sick?
mm-hmm.
And we communicate with the provider, and talk to them saying, well, he wants to run this test. Well, that's great. We also have this test too. Should we run that one? We kind of work really well with the provider and the nursing staff to try to care for that patient.
And Grace had asked, what is an important characteristic a medical laboratory science should have? And you just rattled off a number of those.
I did.
skills, which really, I think you did a great job answering her question. You had shared a slide about how many, there was a question about how long do you have to stay in college? Is it 4 years? And you, depending upon kind of your interest, where you'd like to.
And like I did 5 years just because I took a bunch of extra biology and chemistry classes, because I really enjoyed it. And with the bachelor's degree, you don't have to have a minor in biology, but I wanted one. So it took me a little bit longer.
So a question that has been asked, have there been any unconventional tests you've had to run for patients before? Are the typical tests or the labs that you run, are they pretty traditional
Yeah, they are. They are. Yeah, anything that's really odd that the provider would order. We only have a certain test panel at our hospital that we run certain tests. Anything that's really oddball, we would collect that sample. We would send it to a reference laboratory. Since we are a smaller laboratory, we don't do everything. We can't. I mean, there's thousands and thousands of different types of tests that the provider could order. So we have, our panel of a couple hundred tests that we do here. Anything else will go out to our reference laboratory for them to run. And there are times where they'll order a test and I have no idea what it is. There's so many new things coming out all the time. So we have to research things and get back to the provider, he'll want a certain test that will diagnose this disease. Well, what do we order? So we have to work with him and our pathologist to try to figure out what to do for that patient.
And you currently are working and have mentioned working in a hospital setting. Do
Yep.
clinical laboratory scientists work in other facilities or other types?
They do. Yep, they do. We have some larger clinics in urgent cares where we do have clinical lab technicians and clinical lab scientists working and running some tests. A lot of those tests, they're called point of care tests. They're like quick tests. Some of them do have the large hematology or chemistry analyzers, but yeah, you can work in a clinic setting. There's also, you can work in other fields too, like the state lab of hygiene. There's that's a huge lab in Wisconsin. Those are all medical laboratory scientists that work down there in the various areas in that laboratory. You could get into like forensics. That's another field that this could take you to. Food science. If you don't like working in the clinical lab, you could go off and work in food science or pharmaceuticals, because we do have such a big chemistry background, which helps.
Awesome.
Yep.
Were you ever torn between two different, so you mentioned a couple different pathways with your background and your training.
Yeah.
Were you ever torn between either two medical careers or even two laboratory settings?
Actually, two medical careers. When I was almost finished with my degree, I was contemplating actually going to med school. I really did want to go to med school. But then I looked and I said, okay, do I want to spend another 10 years in school or do I want to start a family? So I kind of took the family approach, but I did want to go to med school. I was very interested in oncology because I have a family history of cancer and things like. I thought that was very interesting. And actually, I do have a very good relationship with our oncologist on site. So I do get to delve in that a little bit. So.
All right.
Yep.
Good. Of course, we're living in the midst of a pandemic.
Yes.
So a question that we were chatting about earlier before the students logged on was how COVID has affected your work. So could you share a bit?
Oh, yes.
Yes.
It's been a crazy world since March. Volumes have went up substantially. We have a lot of sick patients coming into the hospital, and now more than ever, we have to protect our associates, our laboratory associates that work in the lab, our RNs, things like that. Every patient that we touch, we need to have, our face mask on. We have to have the big helmets on, and we have to have those big yellow gowns on. We have to protect ourselves so much now, which we haven't had before. We have about double the volume of samples coming into the laboratory. So we're very strapped. It's been very stressful.
Mm-hmm.
But the laboratorians do like it. I mean, they live for stuff like this. They like it busy. They want to keep it active. So yeah, they're loving it.
Now at your clinic or at your site, are you doing COVID testing there?
We are. Yes, we are. We actually have a small point of care analyzer. It's PCR, which is it's the gold standard for testing is PCR. So we only do this test though for any patients that need to be admitted or any patients that need to be transferred to a different facility. All of our other outpatient testing gets sent to our reference lab at Columbia St. Mary's in Milwaukee.
So you had talked about kind of how you started. You went to college, you were an intern, worked in the clinic, and now your current role as a manager. So how has that transformed, and how does your manager role look different than being a lab scientist?
Well, I don't get into the lab as much anymore to actually do patient testing. It's more coordinating everything in the laboratory, making sure that policies are up to date. We have something called proficiency testing that is a regulatory requirement of the laboratory. We get unknowns from certain companies throughout the United States where the techs need to test those and make sure that their skills are up to set. We have quality metrics that we have to meet with turnaround times for certain analytes in the laboratory, certain tests. So we got to get those tests out as quick as we can. So I have to monitor that. Having good relationships with our other clinical providers, nurses, any MDs, NPs, nurse practitioners in the hospital. So I have to keep that relationship, very good. So.
So are there certifications that you have that for the staff that works underneath you that you manage, or do you have to manage that they're up to date with their certification?
Yes, I do.
And
Yes. So for the medical laboratory scientist or the technician, they have to have certain continuing education credits every 3 years, and they have to submit them to the American College of Pathologists every 3 years to renew their certification. So I have to keep that up to date and make sure that they have that certification every 3 years.
And is that something typically the clinics provide for them, or is it something that the professional themselves or the lab techs have to seek out
For
for theirs?
Yeah, for our organization, we provide those CE credits for them. They do have to pay to get that certification, though. It's like $200 every 3 years. But we do provide all the education for them.
Wonderful. So you talked about you brought in your family, you decided to make a family choice
Yep.
when you were going off to med school. So
Yep.
what does this role, your current role, or when you were working more in the lab, how did you balance that with your family? Now
It was hard at first. When I graduated, I worked the night shift for 3 years. And during that time, I did have a baby. So it was a little difficult, trying to balance that with my husband and my child, having a lot of help from your family members. So there was a lot of days where I didn't get any sleep. I worked the night shift, came home, I had a child, I slept in the afternoon. And then after 3 years, I came on to the day shift, which was a little bit easier. But I think every student graduating from a college, or even, just from high school going out to the workforce, they have to realize that you're not going to get that day shift right away. You have to start out somewhere, and sometimes you have to work the night shift or the PM shift, and then work your way up after that. And that's what I did.
and weekends, because
Yes, and weekends and holidays.
yes.
Yep.
Yeah, so it's a 24/7 career
It
path.
is. It is. It really is. And if you work in a hospital, it's going to be like that. Clinic is a little bit different, where it's, you don't work the nights. You may work PMs, and you might work weekends. You won't work holidays, though.
Mm-hmm.
Yep.
So talking about balancing that family and your
Mhm.
professional world and your career, a question that a student had was, if someone were to still go to medical school, do you think they would still be able to start a family eventually if they wanted?
Oh, yeah, they would be able to. They really would. Yeah.
Mhm. Yeah, and I think that, maybe you just monitor or balance your work, your school, and your family,
Yep.
and kind of have
Oh, yeah. Yeah.
figure out what works for you
Yep.
and how that, yeah.
Mhm.
Every program, bachelor's degree, or even your certificate, you don't have to go full time. Students,
No, you don't.
they're training part time and
Yep.
still have a family or still work and kind of figure out that
Yep.
balance.
Yeah. Yeah. And we take some students at the hospitals who have families, and they've gone to school part-time. When you're in your internship, that is like working a full-time job. So, you have to balance it a little differently. But when you're, taking your classes, you can, balance it to make it work for your family.
Wonderful. So we only have a few more minutes left. And so if any students, if you have any other questions, if you could ask those at this point. I think one of the questions that I wanted to ask is, looking back over high school through college, what is some advice that you would give to our high school students to take advantage of or get involved in now to help them grow as a professional within the health science area?
Well, just kind of think of what type of career path you want. Do you want to be with patients? Do you want to step back a little bit? Do you really like, your science classes? For the laboratory sciences, anybody who loves chemistry and biology, this is a great path to take. If you want to be more hands-on with patients, nursing would be really, that'd be a great field. Even I manage the radiology staff right now. If you like your sciences, that's another great field too, is radiology. It all depends on what your interests are, and if you ever have any questions, reach out to some of the hospitals, or, I know Dawn coordinates, some stuff with the hospitals and clinics and things like that. Come on tours, ask questions. That's what I did when I was in high school. Two of my cousins are medical laboratory scientists, and they used to bring home their books on breaks and stuff. I used to look through them. I was like, hey, this is pretty cool. So, I mean, that's what kind of led me in this path.
Nice. Awesome.
Ask questions.
Super. And one of the last questions, once you're done with your shift, do you get to go home and relax, or do you find yourself focusing on your job?
I'm always focusing on my job. I think that's one of the downfalls of being a manager, being a leader. I can't turn it off. I have people calling me all the time. I'm always checking my emails, making sure that my associates are okay, because I want them to do great and I want them to feel good. I want them to, want to come to work. So.
Mhm. Wonderful. All right. There's one last question. Is anywhere allowing job shadowing? And I think at this point, as we're living in the midst of a pandemic,
Yeah.
social distancing and all of that is the most important thing. So utilizing the virtual career experiences
Yep.
that we are doing today is the best
Mhm.
way right now to do any type of job shadowing. So,
Yep.
well, thank you so much, Melissa. It was
Thank
great
you.
to hear your story and all the great information. I think everything that you shared was super helpful for our students. So thank you so
Good.
much.
All right. Thank you.
Awesome. And thank you, students, for connecting in today. So I did post a link into the chat box. This session was sponsored by the new Northeast Wisconsin Area Health Education Center. It's new AHEC is the acronym that it stands for. And they're providing sponsorship so that these sessions can be open to any student throughout the state of Wisconsin. And they have a survey that they would like you to complete on the overall session and the information you received today. So if you could click on the link in the chat box, takes just like a couple of 30 seconds to fill it out. That would be great. And again, thank you all for joining us this morning and spending time learning about possible future career interests. We're happy to have you, and we look forward to seeing you at our future sessions as well. So have a good rest of your day, and we'll see you soon.
All right. Thank you.
Bye-bye.